My name is Dr. Samson Arigbamu. I'm a nurse practitioner. I've been in the healthcare profession now for about 25 years. About 4 years ago, I invented a digital stethoscope. It's a smart stethoscope that's capable of identifying long and hot sounds within 10 seconds. It's able to announce its findings to the end users. It also comes with mobile application and web application that makes it easy for the stethoscope to communicate its findings from the device itself to the mobile application and web applications. The reason for inventing this stethoscope is because I noticed a lot of providers, including nurses, nurse practitioners, doctors, physician assistants, nursing assistants, medical students. They have difficulty in discerning long and hot sounds. So because of that, so many of them, majority of them, they really don't see any value in the stethoscope itself, the traditional stethoscope. A lot of times they wear it just as part of the uniform because it needs to be worn, but they really don't understand and able to discern those sounds, especially in emergency situations or even in just general patient physical assessment. I realized in my practice that this is really, it could be dangerous and could be detrimental to the patient's health. Sometimes it leads to unnecessary hospitalization. Sometimes it leads to delay in care. A waste could be wasteful when it comes to resources and actually deploying other diagnostic testing that may not be necessary if a good physical assessment is completed on the patients. So I embarked on this journey 4 years ago along with my colleagues, lots of physicians, nurse practitioners, physician assistants, and nurses to develop and bring this device to market. So far, since the last 4 years, we have raised about $1.4 million that we've expended on this project. The project right now is in the final optimization phase. We have completed all the prototypes. It's now going through the optimization and the FDA documentation process. The goal is to submit to FDA by the end of this year, November, December 2023. So this is why we are doing this. It's going to definitely improve care, be a teaching tool, even to medical students, nursing students, a lot of providers even right now. During the process of the production, we realized that a lot of physicians, when we have the same subject and they were listening to long and hot sounds, that they were not actually able to discern those sounds as accurately as a lot of people would think. This device is different from many other one out there. There is no other stethoscope out there, a traditional stethoscope out there, digital or not, that is able to identify long or hot sounds. The ones that are the closest predicate, they are able to amplify the sounds, sometimes get the sounds and transmit it to a standalone office or a place whereby consultants or specialists can actually take a look at those sounds, then provide feedback later. This stethoscope, the smart health stethoscope, is the only one that listens to these sounds, identify the sounds within 10 seconds, and announce its findings to the end users. When time permits, if I'm allowed to talk more about the stethoscope, I will provide even more information, detailed information about the stethoscope. Thank you.